Please. All right, so we're here for an update on the forensic pathology. If you'd go ahead and introduce yourself.
Hi.
Jeff, whatever.
Go ahead.
Go ahead.
No, you could.
I'm Dottie Owens. I am forensic consultant for our Eastern Idaho Forensic Pathology Center.
Okay.
Why don't you just go through the
You
binder
ready?
and give us what you got?
Okay, good morning. In front of you is the packet on our budget and numbers. I want to go through these just section by section. I will go through them quickly, but I have some things that I want to go over and discuss with them. Going through our A budget, forensic pathology, I estimated that at $285 just based on the job list, the posting that we have currently out there. That is not a loaded cost. I didn't get those numbers in time to add those in there. And I think Braden has got those. So we need to add loaded in our forensic pathologist position. The forensic tech, due to the number of cases, this is going to be more.
I'm sorry, can I just interrupt you a second?
Sure.
I don't know what that means.
Oh, I'm sorry.
loaded
So
cost.
for our loaded cost, meaning the insurance and benefits on top of that.
So this does not include benefits?
The 285 does not.
I see.
Do you
Okay.
have that number?
I don't remember.
Add 40%.
Okay. I'm not gonna write that on there. I'm gonna put it in here. The forensic tech position, that we just listed it a full-time. That will actually be a part-time for probably the first 2 years. But that wage at $48.5 is listed as a full-time position. And then administrator and transcriptionist. So a lot of the forensic pathologists that have inquired about this position that I have been speaking with actually they purchase the Dragon Speaking forensic program and do their own dictation. And so I removed that completely out of there because the Dragon Speaking and I didn't know anything about the forensic version. We've never used it anywhere that I've ever worked. And actually I've got a family member that's a PA and they use it on the medical side all the time, and she said it's 10 times better than right now for them, and for the size of the office it would be better than hiring out. They use transcriptionists when there's obviously like reports like what we're dealing with in Ada. And then overtime, I added that on there. We don't have that listed anywhere, and it's not going to be needed for the next year or two, but that's just something to think about as you're moving forward, because some weeks you're going to have busy weeks where you're going to have a forensic tech that's an hourly position, and you're going to have some weeks where they're working over because there may be multiple homicides, and then you're going to have some weeks where they're not hitting that part-time, full-time hours. And so that's just something just to think about that I want to make sure that is on there. I don't have a dollar figure because you're not going to need that for a couple of years.
We can probably make that comp anyways. That's what we do for the rest of the county.
And that's what I was wondering. That's why I didn't put a dollar figure in there. So that's the basic A budget. Yes, sorry.
The 285.
Mm-hmm.
Why was that the starting point?
So in order to hire a forensic pathologist, here's the problem. Number one, we're dealing with a national shortage, and I've been saying that for years. I just returned from the American Academy of Forensic Science conference in Orlando last week, and it is still a huge issue. And so even to the point where they're trying to get our accreditation boards to start accepting forensic pathology assistants to help with autopsy numbers, because they're just not being able to hire. In order to actually staff and hire a doctor, you're not going to get anybody to come and work for less than that. Texas right now is starting their forensic pathologists, even in their rural areas, at $485. So there's 400 of these ladies and gentlemen in this profession nationally.
I'm sorry, you said that the starting salary is $485,000?
In Texas, yes. In
Okay.
Florida, the starting salary for the same position is over $350 plus benefits.
But you think we might be able to get 280, I mean, realistically, are we gonna get 285 or are we looking at over 300?
I think we can get somebody here at 285 because of the caseload. Nationally, your national standard caseload is 250. So in order to get this facility accredited with one doctor, we have to stay under that 250 threshold. And so to a forensic pathologist, 120 cases to 180 to 200 cases is, what did they tell me yesterday? It's actually a golden opportunity for somebody. So what we're probably going to get is someone that's worked in an area like Las Vegas, in Orlando, Orange County, LA, that's worked, they're doing 1,200 homicides a month, which some of them are, and they're coming from a location like that where it's all homicide central to an area where they've got 120 cases to 200 cases max is what we're anticipating for the next 10 years, right? So that's a pretty, it's not an easier job, but it's pretty lax compared to homicide in court and caseloads in these high areas. I actually have interest from a doc that has been in contact with me that is from the East Coast, and he said, in the office, he's been dubbed as the homicide doctor, and that's all he does. And he's working 7 days a week. So when you come from an area like that to where we're at, wage-wise, our wage per caseload is very good and comparable.
And have you looked at other actuals at different autopsy centers around the country and seen where there are people really at the high 200s?
I have, yes, and they're lower, it's a caseload based. And it's the case type based. So we are in a state where, fortunately for all of us, our homicide rate isn't crazy high. It's our overdoses is what's getting us, right? And so an overdose versus a homicide case, especially when you have an autopsy of someone that has been brutally murdered or shot multiple times, one homicide can take 2-3 days. We had a situation in Ada 7 years ago where we had a triple, and those three bodies took us literally a week to get through and process. That's the difference. So where we have a state that we're doing, especially with Eastern, and I have that broken down into numbers, what kinds of cases those are. If you'd like to see those, I can send that to you. We've done all those studies. But for Eastern Idaho, the majority of the caseload is going to be a few homicides here or there. I would say less than probably 10 a year. And then it's going to be your overdose numbers.
I'd say in response to your offer there, the more data, the better.
Okay. Yes, and as far as the study with other centers, I have that as well.
Yeah, that'd be great.
And I have all the listings of forensic pathology positions on a national level, who's hiring, what their pay scales are.
Okay.
Yep, I'll send that to you. Okay, any more questions on that section or that position?
What's the chief administrator going to do? I didn't hear you.
So
talk about that
your
one.
chief administrator position is going to be your manager of that office. That's basically that admin. So that'll be managing the docs, managing your forensic tech, the hiring, internships, those kinds of things, ordering supplies. One thing a forensic pathologist is not, and that is a manager and administrator. The doctors that I have spoken with that expressed interest in the position, that's actually been one of the very first questions I've been asked is, I don't want to manage it. So as long as I'm not managing it, I will look into applying, and that's just the way that it is. Unfortunately, because of the number, and we're sitting at 400 of these individuals in this profession a year, they're just not, unless they're completely retired, they're just not wanting to manage a facility.
And just to be clear, make sure I understand you right, none of these positions include benefits, right?
Correct.
Okay.
So we need to take out the top part that says includes benefits, and that takes care of that.
I thought I did not. I did remove it, but it did not save.
Okay.
Yes.
Perfect.
I actually did that, but it didn't save it, so, okay. And then moving into your gray, or the kind of tan area, reimbursable, what this is these are case-by-case This is testing that's ordered case by case at the discretion of the forensic pathologist, okay? We are always going to have histology on every case. I'm working on getting numbers. I've been asking the hospital for the last 2 months to get me per slide cut numbers because that's how they bill on these. You're looking at anywhere $25 to $30 is reasonable. If we're sending it out, it's more expensive. And I know that from, we actually were doing all of our histology with a company in Boise that is no longer in business. And so the hospital is looking at taking those over. And you're about 25 to 30. And then nationally, if we're mailing out, you're almost $50 a slide. One case can have 10 slides. So that's very expensive. We don't want to do that. But it's all reimbursable by that county on top of the autopsy fee. These are additional expenses on these autopsies. Genetic screening, those are on infants only, so these numbers are all going to be high. I'd rather overestimate these than under, but they are all reimbursable, dollar for dollar. Your toxicology, same thing. Toxicology is ran through, the coroners all have their own accounts with labs. When we have a case that would come in and the forensic pathologist is going to order tox, they would order it, and we've actually gotten it set up so right now where the coroner can be direct billed instead of pulling it from the facility's budget and then having it reimbursed, because that became a problem in Ada, and we were going through $100,000 in toxicology in 9 months, 8 months. And so we set these up so that each coroner in the county is direct billing by the lab. Your forensic odontologist, I put $1,000 in there, just standard, but just so that you know, we have a forensic odontologist that would love to contract with the county, and he is retired and fabulous and works out of Oregon, and he is free. So he costs nothing, but I built in a cost because if something happens to him in 6 months, God forbid, and we have to find someone else and they charge. I don't want to just zero that out. But again, those are completely reimbursable to the county by the contract county for those cases.
So are these numbers included in your budget total?
They are.
There.
They should be. They may not be. Okay. I had this set up when we ran the first original numbers, so we probably did pull them out.
Can I get this from you in Excel?
You can?
Okay.
These, I'm sorry, these can't be included in the
They're
new
not.
budget, yeah, okay.
So moving forward, these are just basic expenses. Some of these, IACME accreditation fee, these aren't going to go into play until that accreditation's in place and applied for. And you're looking at a year or so before we can apply, just because of getting everything set up and rolling. And they're wanting, when they come in and they do an inspection for an accreditation, they want to review case reports, those kinds of things. So you have to have those generated in order to get that far with it, but I included it in our numbers. Vaccination of employees, that's a per county cost. I don't know what you charge here. Ada charges, and I estimated it to be $150. Hazardous waste. In our discussions with the hospital, they're going to include that in the hospital contract. So if that's not an upfront expense, that'll be once we're in the facility at ISU. Because they're already, they have hazardous waste going out every week. And he said, no, there's no need to do that. We'll just build that in. I don't know at what, and again, I haven't seen anything from the hospital yet.
No, they're
so.
close on numbers though. We were hoping to have them today, but there were a couple of things they still need to add in, so.
So we're talking about a hospital contract that's preliminary to the actual lab.
Correct.
Setup. So does this take into account when the lab comes online? Because then we would be absorbing all that cost, wouldn't we?
That's what these are. So all the numbers that I added in here is if we were operating on our own outside of the hospital at the ISU facility. That's what this is.
Oh, okay,
So we're over on several of these, like I said, like your hazardous waste.
while we're at the hospital.
Yeah.
Yeah, but
So-
so when you're talking about hazardous waste contractor, $1,200 for a year? is what
Probably.
we're anticipating? Yeah. Well, it seems, I don't know, it seems low to me, but,
No, Ada County's wasn't high, and we had, it was done by volume.
uh-huh,
and it's a volume based.
Gotcha.
And so I know what we were paying there
Yeah.
for our volume there.
Mhm.
And of course, we're gonna have to get local bids on these, right? We
Mhm.
haven't gone out for bid on any of this.
Uh-huh.
This is all probable, and I overestimated it.
Uh-huh. And I guess it's public record that we could take a look at the 80 county costs with respect to this.
I can actually send that to you, I have.
Yeah, that'd be great.
And how many years would you like?
Oh, maybe the last 5 years would be good.
Okay. I don't have that with me. I took it out of my binder. I'll send that to you. I have that.
Thank you.
And then I estimate office supplies, and for this facility, you're talking paper, just folders, basic office supplies, nothing major there. Photo supplies, once generally the equipment is purchased, that's card readers, those kinds of things. There's really not a whole lot that goes into that as well. A lot of that's all digital anymore, so it's all uploaded. Going into morgue supplies, surgical blades, basic surgical tools, gowns, PPEs, gloves. One thing I do want to say, when we did talk to the hospital at the first meeting, they said that they would include that in the contract. At the later meeting that we had, the second meeting that we had with them, they came back and said no, that the way that they're purchasing that, they can't quote unquote sell those materials, and so that county would have to supply their own going into the facility. So I added that in there. Cleaning supplies, again, that's not going to be in there for hospital. We asked them about that, and they said no, they have their own, we could utilize cleaning supplies that were already in that facility. Needles, syringes, scalpels, again, that's going to be standard. Chemicals, non-cleaning, this is your formaldehyde, that kind of thing that we'll need. Vacutainers for pulling samples. And then moving on to page 2, again, a lot of this is, we're not going to need because of the hospitals, in the hospital setting, but we will at the ISU. Your evidence dryers, you're not going to have that here at the hospital. I'm hoping to get that actually an evidence dryer purchased on grant. Your x-ray equipment, which is your dosimetry service, that is something that we're going to have up front. And then we had like a basic equipment replacement for Ada, but the thing going into this is you're going to have everything purchased out of the gate as you're going into the beginning of operations at ISU, and so you're not going to really be replacing old and outdated equipment. So, but you always want to put it in there.
Wouldn't hurt to budget for it.
Correct.
Because we're gonna have to build reserves for the first.
And that's what I would, in
Here.
case something breaks, you have a bone saw that breaks and we have to order a new one before the old one's fixed type of thing. You want to make sure, yeah, I want to put something in there. You just never know.
I have another question on that.
Yes.
On the equipment replacement, what kind of equipment are you talking about? You said bone saws. What else are you talking about? Are you talking about x-ray machines, other big equipment, small equipment, all equipment?
Small, because the x-ray machine, what we're looking at is a portable. And again, I think we've got grant funding for that. But they're about $1,800 to $2,300 new, and they warranty those. So if something were to happen to that in the first 5 years, you've got those warranties in place on them. So when I talk about the equipment purchase, our bone saws, those kinds of things, they do break. They're mechanical. For instance, we went through a period of a certain brand where we were replacing them, 2 of them a year. Well, come to find out they had faulty cords and issues. So then we had to switch brands. So I always want to build that in. Even if I've got a bone saw that we paid $3,500 for, and it's under warranty, you still have to have something in its place while we're returning that item.
Right.
So that's just an immediate, oh, we broke this, we need to go purchase a new one while we recoup on, right? So I'm talking small equipment on this.
What is the total value of the small equipment and the total value of large equipment that's going to be going into this lab?
So your small equipment is going to be things like our scalpels,
Yeah.
right? Cameras a big expense.
Well, I mean equipment that would break down and
cameras are a big expense,
Right.
about, that's your $5,000.
Right.
And those are a necessity.
Right.
The one thing that we always did see breaking down were things like, honestly, and I hate to keep picking on this, but the bone saw was a big one.
Right.
And they are a big purchase. To me, they're a big purchase at $3,000. And so on basic day-to-day equipment, that's where you're gonna see expenses. And then on your big equipment, to be honest with you, really never had, once it's purchased and in, all of that's very warranted well. So your cooler, your freezer, your evidence dryer, those kinds of things are your big equipment. Your digital, like a digital organ scale that we have to have, is about $1,500. X-ray equipment, like I said, your portable is about 18 to 23, 2,500, and those are pretty. I mean, those are pretty hardy.
But everything eventually wears out. Everything.
Oh, correct. Absolutely.
So I'm just curious. So the total value of small equipment we're starting with is what?
Well, I've broken it down for you. I didn't add it all up together because that is your basic equipment going in, right? So
This is operating cost though, right? This isn't actual.
but that's what that is. So you have to, for me, for the one that's worked the business, my operating costs are going to be my scalpels, my needles, my bone saws, my cameras, because that's what I have to function on a daily basis. My portable x-ray machine, right? You've got to have that equipment up front.
So this estimate, all this really here includes, all the small equipment is included in this budget ongoing?
Correct.
use?
Correct.
Okay, so for large equipment, what's the total value of large equipment we're gonna have?
Well, and that's going to be part of this building design. And
Yeah.
the reason for that is because I don't, are we going to do 2 beds? Are we going to do 3 beds in a unit? If we've got additional funding from an outside source and we can do a third autopsy bed in there, then we need to look at that. And so we haven't, in the procedure, we haven't gone to that point yet.
Right, but so included in here would not be, or maybe it is there a budget for replacement of large equipment? Even though it's down the line, would you be building up reserves, and is that included here?
That isn't included in this, no.
Okay,
This is your daily operational, right, not big equipment replacement.
but ultimately, we would have to have something for reserves for big equipment that's, even if it lasts 20 years,
You would
eventually we're
want-
gonna replace it.
Correct. You would want to for down the line, but the thing is with this equipment, it's kind of like, I don't know if you're a fly fisherman, but it's like fly fishing.
Yeah.
Once you put the investment and you purchase it initially, then it's just your operations moving forward. Yes, you're gonna have equipment replacements probably every 10 years, your scales, I know that the scale that we had at Ada County, rule of thumb with this is just kind of like your vehicle. You take care of it and you have it maintained and you pay to have it maintained, it's going to last longer. So if you have those, the different companies come in and maintain your equipment throughout, you're not doing big equipment replacements.
So what we'll probably do with this is we'll set up, we're gonna have reserves anyways, which I don't know if we'll be able to establish through the ARPA funds, or if we'll have to figure out how that's gonna come in. But now that we've got a little bit better numbers, we can determine how much we need to have for reserves. And then we'll start putting a plan of how much the autopsies are gonna be, building a little bit of reserves. Once we get the equipment list, we'll have a useful life for them, and then we can get a cycle of planning to replace it. And if we don't have to, great, but we'll have the money in case we do need to. So we'll set all of that up as we set this up.
Gotcha.
This
But
is
I'm just
very-
trying to make sure I
No.
understand what's included here,
You're-
and so that would be an additional cost.
Well, and depending on what is done with the room that we have in the area, correct?
Right.
And
Okay.
that's, as soon as you get through all this, I wanted to bring up ISU's ISU's contribution through the state monies and how that needs to be spent, but I wanted to get through this first.
Okay, so supplies, I put, we were at vacutainers, evidence dryer replacements, I know what those, I priced all of that. Again, I did the 5,000 for equipment replacement, morgue scale maintenance, educational supplies. Some of this we can narrow down and not spend, but I wanted to put it in here. Scrubs, you gotta have scrubs. Uniforms, if we do anything and they're out, if they end up assisting, doing a county assist, and they're out on a scene for whatever reason, you gotta have identifiers, right? So you gotta have jacket, whatever we need there, or we don't. I did printing, and that's your initial business cards and letterhead, for the facility, things like that. Idaho State Board of Medical License, it's $250 a year. I left it the same all the way across the board. That hasn't changed since I've been in it, so I don't foresee them changing the fees for that. National Association of Medical Examiners, that's the membership for the doctor. Idaho Medical Association, American Journal of Forensic and Medicine Pathology, ABMDI, that's for your administrator of the office. You have to have that to get accredited. Idaho State Association of County Coroners, their membership's $150, and that hasn't changed. I think we've changed it once in 10 years. ICME office membership, Board of Pathology, and then your Dragon Speaking Dictation, which is a program I was talking about that actually does that dictation for the doctor versus doing the transcriptionist. A lot of them are going to that. That's something that I was unaware of. We still have transcriptionists in the state of Idaho. So that's something that was actually preferred, which I was surprised about. CME and continuing education, the doctors have to have it to maintain their medical licenses. A lot of them will just do the CMEs online versus taking a conference. They like doing that better. Again, the NAME conference, usually your forensic pathologist will go to the NAME conference and get their CMEs. If they attend a conference, that's usually the one that they go to. So I put both of those in there, and then your forensic tech training. So total A budget, total B budget, and then number of autopsies.
And then just quick math, I added up 40% benefits, and that took B budget to 573.4.
So then I have a question. Do we do that on the tech position and that's a part-time?
It would be 40%, but where you budgeted it at
Just put
full-time, I would just add
Okay.
40% for now.
Okay.
And then, as we fine tune this, what we can do is if the board wants to say, nope, that's gonna be part-time, we'll cut it in half, and then we'll determine how many years. We go with just 2 years, then we can tweak those numbers. And as soon as Dottie sends me this in Excel, I can do that. And then the other thing I would do is add up the tanned area into the
Mhm.
costs, but then show revenue in that same amount,
Okay.
just so that you can see the offset.
And for things like your forensic odontologist, even though those services are free, I would keep that in there, to be honest, because you never know.
I'd rather over budget
Yes.
and have it covered.
That's how I have felt.
Yep. Because we
I-
probably won't have the abilities to open the budget, to add budget authority, so it's not there.
Mhm.
Yeah.
And it's the same thing with all, with genetic screens. Those are only on infants. So given the number of infants that the center may do a year, that's probably high,
But then you have
but then we
one
have,
scenario and.
yeah. So then what I provided to you next is the Ada County, these two Ada County data, okay? This is the original numbers that I, right out of the gate, sent to Chris at Smith Group when we started this quite a while ago. And the reason that I put this in here is because I wanted you to see the history of the counties and the number of autopsies from 2018 forward. Okay? The reason that that's important is because we have a lot of factors in this. I did a survey with the state, it was about a year and a half, 2 years ago, and I sent it out to all the coroners. If we were to take out travel times and budget, your two big things, how many more autopsies per year would you do? And the reason that I was doing this was not for this project at all, but for the fact that from a national standard standpoint versus what Idaho is doing, it was more of a state survey, state research project. I wanted to see, based on what they should be doing, if you omit budget and you omit travel time, how many more autopsies per year would they do versus what they are doing, right? And so when I put this together, these are the basic numbers that I sent to Chris that are what they have been doing. With that being said, we have coroners in the state, and some have since moved on and retired, and we had I think we had 9 new ones this year that came in. I do know we have, like, and I'm just going to call it out, Oneida. I know that the new coroner that has taken over in Oneida has been working with Tori to get trained. He wants to do autopsies, and he didn't understand why they weren't for his county. Bear Lake is another one. Clark, Caribou, Fremont isn't doing them. And when we did the survey, it was, well, the problem is it's 5 hours or 4 hours and crappy roads, and I'm the only one on staff, and I can't afford to leave, because those coroners try to transport with that decedent so that they can discuss this case as they're doing autopsy. A lot of the times the doctors want them there. And so there is our numbers. When we're looking at the numbers, our numbers for the state are low. What they should be autopsying is 1 per 1,000 in their county. So then your next page, okay, that's these that I put in there, are actually your autopsy rates. And I did your population, what their 2021 number was, rate per 1,000, and what their 2021 number should be. Okay, and I did that for 2021 and 2022. And so when you're talking about 1 person per 1,000 in population, that's nationally what they recommend, because of the number of deaths per county. Your coroner should be looking at investigating and autopsying at least this many cases each county. So why I think that this is going to go up, and why do I think we're going to hit our numbers? Well, Idaho is being inundated with fentanyl, horribly inundated with fentanyl. I had a presentation with the federal attorneys on Friday that we did to the Criminal Justice Commission for the state. And their number one reason for not prosecuting in the state of Idaho on fentanyl deaths and trafficking is because they're not getting autopsies done. Their number one reason. No autopsy and no tox. They cannot prosecute a federal case without those 2 things. And the only counties in the state that are autopsying overdoses is Bannock, Ada, and Kootenai. That is it. No one else is autopsying these cases. So the other piece to this is we have jurisdictions in the state that aren't even pulling toxicology on individuals that are 35 years old, deceased, found in a field. They're signing these out. That's starting to change. The state is starting to watch. They're starting to ask questions. I've had a lot of questions coming in from Health and Welfare, ODP, again, our Criminal Justice Commission, and they're wanting to know why are we not doing this? Well, the common answer is, and I've got it all in writing on my survey, budget and distance.
So there must not be any consequences of not doing it.
There's absolutely no consequences. And that's the problem. So what do you do if you have a family member? I don't know about all of you, but if my 35-year-old son was found deceased in a field, and me as mom knows he has no drug history, and I have a coroner that signs it out as a drug overdose with no tox, I wouldn't be too happy about that. And so we need to raise our standards as a state, and our legislatures and our department heads, Health and Welfare, all these different agencies are starting to finally look at this. And 90% of it is, I'm sure, because of fentanyl. So I think our numbers are going to hit 120? I do. When we talked to Chris and gave him the initial, this is what we actually physically did. These are the numbers of our actual autopsies that came through the office.
So if I understand you right, you're saying you did a kind of a survey, I guess, where you asked them how many autopsies would you do if there was no travel and no cost?
Correct.
But we know there's going to be some travel, and we know there's going to be some cost.
Right. And when I said no travel and no tox, so your federal recommendation
cost,
is
right?
under 2 hours. So I added that in my survey.
Uh-huh. But cost will be a factor, especially with small counties, I would imagine.
Correct.
Yeah.
But on the other end of that, if they're traveling 2 hours versus the 5 to Ada County,
Right.
they're going to be more likely to bring those drug overdoses over. They're going to be more likely to bring that questionable case in versus not, because why drive 5 hours if it's not a homicide? And that's kind of what that mentality has been. The other piece to that we're going to be, that we're doing, I actually have been working with Office of Drug and Policy for the state. We have been awarded a grant with the State Crime Lab, and we are going to be offering free talks and free training on these overdoses to every single county in the state. So what that's going to mean is every county is going to be able to do toxicology for free upfront with a 48-hour response, or with getting their results back within 48 hours. NMS Labs right now, and they are wonderful to work with, but NMS Labs is national and they're 4 to 6 weeks. And they may be longer. Are they 4 to 6 weeks? So when I was in, they were running 6 on some of our stuff. So with this, the State Crime Lab is going to be able to run the talks, have the results back within 48 hours. The reason that affects autopsy is because those coroners can hold those individuals until that 48-hour period and those tox results come back in, and then decide at that point if we've got crazy fentanyl in there or something that they need to autopsy. They now have got those results back almost immediately, and they can post those.
Quick question on the subject, but not. Are most all of Idaho counties participating in the opioid settlement monies? Yes?
Yes, they all are, is what I was told.
Okay. That could potentially be a funding option that we could market with this. That if it's appropriate, and we'll have to talk to legal, and of course they'll have to talk to their legal, but if you could do a reimbursement on these, so maybe the county fronts the money, but then if they find it's opioid
Are you talking about
related-
toxicology?
Yeah.
Yeah.
And then maybe if it's found appropriate, then we could use the opioid money, and so could other counties, to do a reimbursement of that cost. And then that way, it's another way to spend that money, but not at the county's expense.
Where does that money come from?
A lawsuit to the
Pharmacy?
pharmacies.
Okay.
So just trying to think of things
That is a
that might.
fantastic idea.
Well, those pharmacies.
Because a lot of the counties, my understanding is having a hard time
Government
spending.
Went after
A class action lawsuit.
Oh,
We
okay,
are.
okay.
Yeah.
How
This
long?
is a great
So this
idea.
is a pool of money that we get every year, a percentage of this?
No, I think it was a one-time payout. I can't remember for sure. Do
great.
you remember about that, Jason?
There, we get several, but
On that opioid payout, is it sequential for a couple of years, or is it a
On
one-time?
our grant,
No,
The
the opioid.
installments for the,
Oh, I've got,
I don't
Lawsuit.
know that.
we've
It's-
got projections of money.
But
that are gonna
it's not
come
a
in.
one-time shot,
No,
it's a
it's not
sequential.
one time.
Okay, that was the
Yeah.
question that John had.
Yeah.
Is it going into the future indefinitely?
Very much. Well, I don't know about indefinitely, but we've got projections out to like
I can't remember.
2030 or
Yeah,
something.
it's a while.
Let me look at it. I don't, that's one thing I didn't bring with me,
I think it was close to
but
10 years.
I have that downstairs.
How much is it, do you know?
Right now, we have
For
about
us?
300,000.
Okay, so you're anticipating we'll get 300 grand every year for this?
Not every year,
Okay.
Right.
but I've got 5 new settlements that I need to get on the agenda to have the commission sign. I don't know what kind of money's gonna come on those.
So the max would be about 300 grand, is that right?
I don't know.
Okay.
I know IAC did some projections on how much certain settlements have.
I'm looking for it right
Okay.
now.
And, I mean, even if it's $9,000 a year, it's something
I'm
that.
happy to take money from
Mhm.
other entities. I think that's been established.
But that's where if it's a reimbursement on those drug tests, I don't know if this will work. It's just an option that if we could use it, if the test is positive, then that might help some of the counties be able to combat the situation.
All right, thanks.
So,
yes, great idea. Well, and then the other piece to that is then federally, because what the idea with this, so the grant, what this grant is we'll do I'm gonna do the 2-day training per jurisdiction so that they understand how to pull, where to pull from, and how to submit these tests into the State Crime Lab. The state crime lab gets the sample. They run the sample, and within 48 hours, the sample is, or the results are sent back to the coroner. And then at that point, that overdose, if it is an overdose and it's confirmed as an overdose, will go into the state, into ODMAP. And what we're working on is interfacing ODMAP with the software. Well, so then that's immediate real-time data for law enforcement and our federal agencies that are trying to prosecute on these. But they can't prosecute without an autopsy. They can't. So we're back to that. So I think once we start doing that, and you omit things like 5-hour travel time on crappy roads, I think they're going to start, and they've told me as much so, that I had a conversation with a couple of them at the Coroner Association meeting. I cannot wait until it's up and running because I'm tired of driving all the way to Boise.
I get hit with that every meeting I've been in last year.
It's rough, and especially, not to be insensitive, but when you're doing a 5-hour road trip one way with an advanced decomp, that's not a fun trip. So there's all these different factors that go into play. Not to mention, we're holding decedents if they're having to transport and they've got a baby case, and they have a baby case on Friday or Saturday, and they can't autopsy until Tuesday because ADA's not taking cases on Monday because of the caseload there, and that was the only reason. Then you bump and then you're holding that infant for 3 days. You're holding it over a weekend and then a Monday. And by the time you get back here with the body and you release, it's Tuesday, Wednesday.
I have a couple questions for you, Donnie.
Sure.
Switching subjects to the growth of the fentanyl deaths, and you projected a growth rate of 10% here. How realistic is that growth rate of 10% in the autopsies, and does that correlate, or is that growth rate of 10% kind of based on what you're projecting fentanyl death rate to continue to increase, or where's that
So
coming
what
from?
I did with that is based on population and projections as far as what they should be doing versus what they are doing, because like I said, on a state level, we're getting a lot of state interest in, if we're supposed to be autopsying one county 50 per year and they're doing 18, what's happening to the other, right? And so I estimated that not based on the drug piece, to be honest. I did it based on your distance, time of travel, more convenient to get them done, open schedule to autopsy. There was a lot of autopsies that, for a while, because of the volume with ADA, we were only doing Tuesday through Thursday or Tuesday through Friday. And I had a lot of them, when you have a Thursday, Friday death, say, no, never mind, I can't wait until Tuesday to autopsy this body. And so when you omit all those factors, trying to be on the conservative end of life, I'm using 10%.
So compare the national, what the standard is, that 1% or 1 per 1,000. How does that compare with our surrounding states around us, like Wyoming and Utah? Are they close to that 1 per 1,000, or are they down where we're at?
Everybody's about where we're at, and it's because of the lack of forensic pathologists, to be honest. I know a lot of states, Wyoming, Montana, struggle to even get a doctor.
So if I'm in Wyoming, where do I send them, or do I just not worry about it?
A lot of Wyoming goes to Denver.
Okay. And then my other question is, ADA's, how flat has ADA kept their autopsy fee over the years, or what's your, because on here you've used a flat fee throughout the whole thing.
So when I took office in 2014, they were $14.50. They hadn't been changed since '07, was my understanding. So we did a reevaluation of fees. I think we changed them. I think I changed them probably 4 years ago, 4 or 5 years ago.
And so if you haven't changed them for 4 or 5 years, do you feel like ADA's due for another cost increase because of?
I'm hearing that they are, yes.
Do you have any idea where?
I have
they're-
absolutely no
okay.
idea.
Okay.
And I know those were questions that were on the board. I did a per autopsy breakdown on the cost
Right.
to include the doctors, staffing, right?
Right.
Including transcriptionists, staffing, and then the morgue supplies that go in on an average case. And you got to keep in mind, when I say average, not all cases are average. We get, there's a lot of multi-shot, gunshot cases that come up, and They're, I've got someone that has been shot 15 times. That's not an average case. So on your average case, I did a cost per autopsy, and that was about $400, $500 per autopsy.
Okay.
In Ada County?
Because of the volume.
Sorry?
Because of the volume.
Yeah, because Ada County did, what, 800 plus last year?
So it was about 680 for Ada, and then 170 for out of counties.
Okay, so that's where you get your volume down, because
The
you're over
number.
800 autopsies.
Correct.
Okay.
Yeah.
How many of those out of county go north, go to Spokane?
So I thought I gave you a map, and I probably did not.
You probably did, I just don't have to take it.
We have majority of Ada County services 31 jurisdictions. And the rest of the state goes over to Spokane. And Coeur d'Alene's actually interested in doing a regional. So the national recommendation, there was a national study that was done several years back. It's called SWIG MDI, and I've sent this out before. I know that you've got it. I can send it to you if you like. But it had stated that Idaho, it was recommended for the state of Idaho to have 3 regionals, one in Ada, one in eastern, and one in northern Idaho in the Coeur d'Alene area. And so Coeur d'Alene is interested in pursuing that for them just because of their caseload.
In building a pathology lab?
They've been asking me about it, yes.
Sorry?
Yes, they've been asking about it.
It's basically everything north of what, Idaho County? Goes to Spokane?
Idaho County goes to Ada. So anything north of Lewis and up
Mhm. Okay.
is all Spokane.
Okay.
So how quick should we have a list from Smith Group on equipment? Because
That I
I
don't
talked to Lisa with ISU, and they have that $850,000 roughly to spend. We can invoice them, but she has the same mindset I do. I would prefer, if it was Bannock County, that we buy something, not just
Right.
give the money and us have to report later. So I've set up an arrangement with her that hopefully this list can get here soon, and if they can buy a piece of equipment or multiple pieces for that $850,000, that's what they prefer to do. She did mention, and this is just the finance person, not anybody else at ISU, but she said they do have a storage unit over at Garrett Way, that if we bought something, we could house it there. I don't know that I would be a fan of that, because you don't know what happens with the
Right.
equipment off-site, if it gets damaged or anything else. But impossible, they want to spend that money, so if we have the abilities that we can buy something before the first part of May.
I think we can do some of that with the hospital. Then the rest of it will be, we need to get you up and work on a layout as quick as we can, because then we'll be able to start to create that list.
And the other thing is, they're probably a little more laxed that they would pre-purchase a piece of equipment, whereas I would never do that, because if it doesn't ever show up, you've spent money. But if there was a piece of equipment we could order, even if it wasn't going to be here right away.
Do you know what
something
lead time
like
is
that.
on some of this equipment?
Absolutely, and that, when you're talking about that, what I'm thinking about is things like the cooler and the freezer unit. Those are things, because they come in, like a pallet, and it has to all be assembled anyway. And so that would be perfect for storage. Your autopsy stations and those kinds of things, I'd be a little more leery about, because that can be damaged, and those are expensive.
Okay.
$12,000 to $18,000 a piece. So you don't want an $18,000 piece of equipment sitting there and having it become, the base of a bunch of storage stuff.
And if it's a piece of equipment that maybe comes on a
Cool.
pallet that doesn't have to be, depending on the weather elements, or if we could protect it, maybe we could house it somewhere as opposed to having it sit elsewhere, if the facility's not ready to house it. But if you would keep that in mind, I told her I would keep in communication with her, so if you can let me know if there's something we can buy, just keep me looped in, and then I can keep her, and then we get that all taken care of.
Okay.
Otherwise, we'll just invoice them and they'll give us the money. But
Okay.
I think we're talking about initially, while we're waiting for the lab to be built, initially we're going to be doing autopsies up at Portneuf, is that right?
Correct.
And so When would the lab actually be in operation, and we're doing them ourselves and not at Portneuf?
I don't know the lead time on that. We haven't, I mean,
I mean, we're
that's,
looking at about a year or what,
Actually, Smith Group was saying 2 years-ish,
Mhm.
18 months to 2 years.
2 years?
Yeah.
So we'd be doing autopsies at Portneuf for 2 years.
Mhm.
And how many autopsies, I mean, can they do all these autopsies? They can do 120 per year?
Well, they would not be, and they're not involved in any of that from the hospital standpoint, other than the location.
So we're gonna do them. Do they have all the equipment, or do we need to buy the equipment and put it in there?
So there is an equipment list for the hospital that we would have to purchase, and what that is, and it's minimal, we have to have, an organ scale. They didn't have one. We would need, honestly, I was talking about this a couple days ago at Best Buy, just a refrigerator and freezer to put samples in that'll go to the other facility, a portable x-ray machine. I've been pricing those, and I've got that information to go over tomorrow, actually. And then cameras, computer equipment, the stuff that we did receive that grant. We were awarded a $15,000 grant for the computer system, the 2 computers, and then 2 more cameras. And so that's all upfront equipment that needs to be purchased for that. And then basically your bone saw, a bone saw, needles, scalpels, those kinds of things.
Some stuff that we could take
And,
with us.
Things that you can take with you.
So we can get that list.
I have that.
Okay, so as soon as we can get that list, then we can start, because I want to make sure that the budget we have set is going to be appropriate for operating. Brandon and I were talking about that just a little bit ago, because it was a complete swag. So as soon as you can get that list,
Yep.
then we can compare, make sure all the monies are where it needs to be.
Right.
And then also, we're going to have to come up with the monies. That'll be part of probably the 7 million to get the startup for the building, if there's anything this year. Otherwise, we could deal with that next year.
So as far as this 2 years of autopsies that we would be doing up at Portneuf, where are we on do we have an MOU being worked on, a contract? I assume we do, but where are we on that?
We're waiting to hear. Portneuf's still getting us the inventory list that Dottie's been asking for, but the MOU with them, they were gonna put something together, we're gonna run it by legal, and then we'll get going on that, but
So we're waiting
they've
for
got one,
Portneuf?
they've got one in the works, is what I've been
Okay,
told.
so Portneuf is going to draft the MOU? When do you expect to have that?
I don't know, I can find out.
Okay.
I'd
As soon
like to
as-
get the supplies and all that stuff, from that's the project they were kind of working on first. So getting that, I don't think the MOU will take them as long. Nate, anytime we've, discussed with him, he said that part should go pretty quick. So I can reach out to him today and see where they're at on that, and then I'll get it to legal.
Yeah, and as soon as we have it, I'd like to see it, concurrent with legal.
And our time frame to start at PMC is May 1?
Depending when we can get a pathologist hired.
Mm-hmm.
Oh, yeah, I guess we need that, don't we?
Yeah.
So my understanding with the contract in the conversations that we have had with them is that they're trying to figure out what to charge on the histology piece.
On the what?
Histology so when the doc orders the histology, they're trying to figure out what they're going to charge and what their charge basis is gonna be for county, because that would be not just a service that we would utilize from them just while we're located there, but that would be continuing, because again, it's cheaper if you can get it done locally. It's going to be cheaper than having to ship it out and turnaround times and those kinds of things, right?
And where, so we're looking at doing them in the hospital. Where in the hospital would all this take place?
They would do them in their labs. They already do histology for the hospital.
I'm talking about the autopsies.
Oh, what, I'm sorry?
They have a
They have a
room.
morgue.
They have a morgue already?
Yeah.
And their morgue is set up to do, are they doing autopsies now?
No.
No.
Okay. But they have basically what they would need to start doing them.
They have a facility that can get us started and
Uh-huh.
get us moving.
And they could handle up to 120 autopsies per year.
They aren't going to have anything to do with the volume. We've had that discussion, and they basically are going to lease us the location and let us do what we need to do, and it is sufficient for that.
And so we don't know what the lease cost is at this
I
point.
don't know any.
We
of
were
that.
hoping to have that number today, but we still don't have it from
Yeah,
them.
that's
Gotcha.
been slow.
We talked about getting it for this meeting, but they didn't get that to us
Well,
today.
there you go.
Yeah.
All right, thanks.
So can I mention just something to kind of think about? There are a couple different things that you can kind of mull over as we move forward with this. Depending on the forensic pathologist that we do end up hiring, there is opportunity to do private. There is opportunity to do autopsies for hospital. Generally, your forensic pathologist will not do private in hospital just because they don't have that knowledge base. Most of your forensic are forensic based, so they are, you know, abuse, trauma, projectile, those kinds of things are not disease. Your regular pathologists, your hospital pathologists, are specialized in the disease process and the natural process. We may be able, with this hire, to find a doctor that is open to doing a handful of hospital autopsies a year and has that knowledge base. Some do, some do not. One of the forensic pathologists that was employed with Ada County that retired, and he was there forever, he actually started out as a hospital pathologist and then got all of his training later in life in forensic pathology and transferred. But he had that dual knowledge base, if you will. So something to keep in mind as a revenue base down the road, there is no one in the entire state doing private autopsies for families. If there is a case that the coroner states is non-jurisdictional because it's non-traumatic, it wasn't expected, and they do believe it's natural, so the coroner has released that jurisdiction, but family wants an autopsy, right now, we're referring them to 1-800-AUTOPSY, and they either have to, and I'm not, I'm not even kidding. And so they either have to arrange for that body to be transported out of state or fly someone in and then pay for a facility for those services. This might be an opportunity to offer private. I get about 10 calls a year. I got one a couple weeks ago actually from a Northern Idaho jurisdiction that said, I have a family that wants an autopsy. Hospitals aren't doing them anymore. And so do you know anybody? And I again sent them to the 1-800-AUTOPSY, and I know nothing about them.
So-
But that is something to think about.
Do we have any, I guess we probably don't have any data on this right now, on the number of private autopsies that are being done in certain regions, but we could probably get that data?
We would know that. We would have no idea. And the reason that you don't know that idea is because I can insist on an autopsy of a loved one and pay for someone out of state to do it, and that isn't going to be recorded anywhere.
But who's doing them?
I have no idea.
So we could
They're all out of
probably
state.
find out who is doing these private autopsies. Maybe they're a public company and we have this information available, so we could find out how many would likely be done.
We might be able to, but that's a needle in a haystack. The only other thing I could maybe do is reach out to Vital Statistics and see if we could maybe do a public records request and ask them how many non-coroner, non-natural, or non-accident, non-coroner on Manor. That's, but I don't know, we wouldn't know who they were and where they were done at.
Well, we don't need to know that, we just need to know the numbers.
It's hard to get information out of private sector.
And I think a lot of them are using locums. And a locum, I know that came up with Smith Group, and locum is not the way to go on any level. They're very, very expensive. I
How
know
much?
when we looked at bringing in a locum, because we only had 2 doctors for Ada, it was $2,800 an autopsy, plus travel and per diems and hotel, and it was per case. Locums are very expensive.
And a locum is a traveling forensic pathologist.
Yes.
Okay.
And then all the other fees on top of it. So they charge for their transcription, they charge for travel, hotel, meal per diems, those kinds of things. They're very expensive.
2,800 per autopsy.
And that was 2 years ago.
Uh-huh. Gotcha.
A
Well,
locum is
after
expensive.
visiting with our elected officials the other day and stuff, I don't feel like we're gonna have a problem with the 120 autopsies. Talking with the sheriff's office and stuff. They, as you said, there's a lot of them that I think will move forward. And some of these counties that have been doing 0, I really believe will have a few, especially as they have some cases come up and the drug overdoses and things that are going on in the area. So I'm looking forward to moving forward. Thank you.
Absolutely.
As soon as you send me that, I'll
Yes.
update it, run it back to you.
I've got, I'll grab my laptop